David Hertel with you on this glorious Friday morning. I'm in for Elias, of course. A new study shows that despite the pandemic lockdowns and month-long curfews, Quebecers' mental health was not affected. Surprisingly, our mental health self-assessment scored higher than people from other provinces across the country. The survey further found that 78% of Quebecers rated their mental health as either good or very good since the beginning of the COVID-19 crisis. So why exactly has there been such a stigma surrounding mental health post-COVID? Jack Jedwab joins us. He's, of course, the president of the Association for Canadian Studies. Jack, great to talk to you this morning.
Always a pleasure to talk to you, David.
So, were you surprised by these results?
No, because they're consistent with what I had seen over the past 2.5 years of survey work in terms of mental health self-assessment. So I probably was surprised when I first saw it, but when I saw it on a weekly basis, coming out pretty much the same, and then we in terms of the polling, moved to a bi-weekly and monthly basis, and it still kept coming out the same. I wasn't surprised. Now, having said that, by the way, the question is a mental health self-assessment. It does not ask about the lockdowns or the curfews. That's sort of extrapolated from Aaron Derfell, who's a very good journalist story.
Yes, of course.
Saying that, we did have lockdowns and curfews, and yet the mental health self-assessments are very positive.
So tell me about, because of course, as you just said, you've been polling regularly, and we've spoken before, and you've been on CJAD 800 a lot of times talking about different polling questions and results. But I'm curious about this mental health self-assessment question. I mean, first of all, how qualified am I to assess my mental health? You know what I'm saying here, Jack?
Yeah, no, those are valid questions. And, we did ask another question about depression diagnosis, and the figures there are very similar to what you see across the country. So Quebec doesn't show a different, at least meaningfully different outcome in terms of the extent to which people have been diagnosed with depression relative to other parts of the country. And, you get a whole number of people or percentage of people in Quebec and elsewhere in Canada who are sort of self-assessing bad mental health, but say they've never been diagnosed with depression. So, we need to do more research in that area. It could be to what they call situational depression for some people. It could be things that are untreated. But, we need a lot more, I think, investigation and research in that area. Because remember, across the period, there was a lot of talk from experts about how we're going through a mental health crisis. Yeah. And it was repeated over and over and over again.
Yeah.
And I don't necessarily dispute that, but there wasn't a lot of documentary evidence to support it, which is what we need to see more of, so that if this happens at some point in the future in the same way, we'll be better equipped to address this properly with a better assessment of things.
So what was the thinking? What is the thinking? I mean, you're an expert in polling, Jack. You work with Leger Marketing, a great firm, very respectable polling firm across the country. So, what is the thinking behind this question? What does it really reveal? What kind of conclusions can you take away from such a high opinion from Quebecers, especially compared to other Canadians, about their mental health status?
Well, again, as you said at the outset, there is a question of, whether people are properly analyzing their mental health, compared to what, for example.
Sure.
But, this is consistent with so many polls across the period. It's a standard question asked not only in Canada, but in the U.S. and several other countries.
So what what's its purpose? What are we trying?
In a sense, you could compare it to a life satisfaction question.
I see.
Right?
Okay.
Where we'll ask about life satisfaction on those 4 or 5 point spectrum. That's for 4 or 5 point scale, and do repeatedly. And do we trust people's own assessment of their life satisfaction? Because sometimes that can be very relative as well. But I think it's relative for all. At a certain point, we have to assume there's some neutrality about the question. When it's repeated so often and the results keep coming back the same way. But then we have to further understand, what underlies that. And we do a lot of polling to try to get at that, So we did notice, for example, in Quebec, the level of anxiety about getting COVID or fear of COVID over most of the entire period was 20 points, less fear amongst Quebecers than was the case elsewhere in Canada. So, the mood seemed to be different. Now, what I thought was particularly interesting, by the way, about this poll is that I sort of compared Quebec francophones to anglophones with an oversample of anglophones to see if is it a Quebec thing or is it a language thing? And it looks much more like a Quebec thing than a language thing, which is interesting.
It is. So now I know you don't have data to explain it, but what's your assessment or your feelings about the discrepancy between Quebec and the rest of the country?
Well, part of me thinks that it's got to do with a lot of social solidarity in Quebec during the pandemic. The messaging of part of the Premier and others was "ça va bien aller." There, beaucoup d'arc-en-ciel, lots of rainbows around, and we're all in this together. Feel-good message constantly being sort of hammered away, and that may have affected people's own assessment of how they see the situation. So, I traveled across the country during the pandemic, although not as extensively as I usually do. And there weren't as many rainbows. So are you going to study rainbows next poll? You never know.
So anything else that's stuck out with this analysis? Anything I'm missing here?
Well, only that I think it's important in terms of that relationship between those mental health self-assessments and people being diagnosed with depression. We need to determine whether those people who said I did very badly in terms of my mental health during COVID, but I didn't have a depression diagnosis. I'm wondering if a lot of people may have fallen through the cracks at that period. Now we get into this other issue of whether this is a situational depression issue. So if it's situational depression, then there's sort of no major threat from the contagion anymore. What does it mean in terms of mental health? Oh, well, the mental health problem went away because COVID went away.
Right.
If that's the case, then we need to do some hard thinking about all the things we heard over the course of the period about the long-term ramifications of this for mental health.
Well, I can't help but feel, but again, it is a feeling. I don't have the hard data you have, but when you look at violent incidents, there seems to be more acting out. There seems to be a problem with our youth. There seems to be just the demand for psychologists. I mean, you're going to say, okay, maybe that it's because of the labor shortage, but there seems to be like a massive increase in demand for mental health professionals. So I don't know. There seems to be other data.
I agree. We need to look at that data because that's what. I haven't seen all of that data.
Of course.
I hear about it.
Me too.
And anecdotally, I'm not disputing all that.
Yeah.
I hear a lot of people in the media saying, "Here's what's happening," but we need to actually document that and understand what segments of the population. I'm persuaded, that women and persons unemployed, which is did disproportionately suffer from mental health challenges, more mental health challenges over the course of the pandemic. There's a McGill study. It got massive coverage. It's an international study, McGill and McMaster, 137 countries, that tracked large groups of people in each country from beginning to end and said there was no mental health crisis. I actually don't think that that's accurate, but they've got a pretty solid study out there. And that's why I'm saying we need to do more research. We need to have more discussion about this so that we can actually figure out what did happen and what didn't happen.
Yeah, no, you're raising a valid point. We need more data, and thank you so much, Jack, for giving us that data and fueling the conversation with facts instead of just feelings. And I think that's really important. It's always a pleasure to speak with you. Have a great weekend, my friend.
You too, David. Take care.
Take care. Jack Jedwab, president of the Association for Canadian Studies.